So this guitar thing that you are talking about comes under functional neurosurgery, where there is a disturbance in the electrical activity of the brain. And the brain is a very complex organ. It's one of the most complex organs in the body. And when there is this electrical disturbance, then patients get either they get spasticity of their muscles, or they get twitching of the muscles. There is a abnormal movement of the muscles.
See, what's peculiar about this dystonias is they have no paralysis. The hands are all fine. Only, and even if he pretends to play the guitar, it's fine. The moment the guitar is in the hand, he tries to play, the fingers start cramping. There's some strange force stopping him. So he showed me these 3 fingers of his left hand, but not just listening to him.
These two have become so stiff, I cannot bring it on the fretboard. I can't.
Got it.
It has become so stiff. I cannot move at all.
I can see that.
See, can you see?
I can see that.
I'm trying, but I cannot.
So there are 2 types of surgeries for treating these people when the medicines or medical line of treatment fails or has a limitation. The first, which actually started with the lesioning surgeries, and then it morphed into DBS.
So deep brain stimulation, in short DBS, is where an electrode is put into the brain, and that electrode stays into the brain, which is connected to a IPG or a impulse generator. And then when the impulse is generated, this stimulates that part of the nucleus which we want to put, and gives an effect. What is lesioning is we go to that part of the nucleus and do a radio frequency ablation on it, or we burn that area or the nucleus, giving a similar kind of a result. The difference is in deep brain stimulation we can do both sides together. In lesioning we can do only one side. In deep brain stimulation we have got an implant always throughout our life. In lesioning we have no implant.
Deep within the brain lies a group of structures known collectively as the basal ganglia. The basal ganglia act as the switchboard for the brain circuits that control movement. One important structure within the basal ganglia, the substantia nigra, produces a chemical known as dopamine. Dopamine is transported to other areas within the basal ganglia, and this enables the coordination of smooth and balanced muscle movement. Parkinson's disease causes the cells in the substantia nigra to die, which results in less dopamine within the basal ganglia. This results in the motor control symptoms associated with the disease. Often, Parkinson's disease is treated with medications. Most medications increase the level of dopamine in the brain or mimic the effect of dopamine. When medication increases the level of dopamine, this indirectly enables the basal ganglia to function at higher levels, thus reducing symptoms in many patients. While medications can be used to improve motor function, it is possible that they may lose their ability to do so over time. When this occurs, the symptoms of Parkinson's disease may again become more pronounced. DBS therapy uses a medical device, much like a cardiac pacemaker, and thin, soft, flexible wires, called leads, completely inside the body. While the device is implanted beneath the skin in the chest, the leads are implanted within the brain. Electrical stimulation is then sent directly to targeted areas within the brain. Stimulation of these areas enables the brain circuits that control movement to function better. This results in a reduction of some symptoms in many patients.
So truthfully, a lot of people think that if I can't afford DBS, I need to undergo lesioning. And according to me, that's not true. Okay, so it's not a poor man's treatment, honestly speaking. So I want to actually clear some of these myths. Number one is both surgeries are equally safe or equally risky. At the end of the day, we're both going inside the brain. One is permanently inside, one is actually I'm coming out after burning, so it's not an issue. So they actually complement each other, rather than compete with each other. So once people understand that neither is it a poorer cousin, nor is it done out of desperation, they have their own indications, and if you can understand that and use it judiciously, like I said, you don't need AK-47 to kill a fly. you can still do this. And those who cannot afford, for sure, instead of allowing them to suffer, you have definitely a cost-effective treatment. It's 1/5 the cost, and they can definitely make a difference. And this is called stereotactic neurosurgery. So we actually fix a special frame to the head, 2 screws in the front, 2 screws at the back. We actually screw the screw into the skull under local anesthesia. Then we do a special MRI, and that MRI gets into a special software that I have. I sit and plan the target. Usually all these targets are more than 9-10 centimeters inside the brain. And we reach the target with a 40-millimeter hole in the skull, through which we can't see anything. So honestly, it's a blind procedure technically, but technically far superior because the technology supports me in what is happening apart from my understanding of the anatomy. And then, so that's what we started, and he had the guitar, and as I'm burning, which I saw happening in Japan, the fingers released. One by one, I had to burn 7 times. As I was burning, he says, "Doc, this is better," and he started playing.
Abhishek's surgery was the first surgery actually Dr. Sharan did after he came back from Japan. A very stressed event, I should say, for us, because it was the first time he was doing, and there was a lot of things that he had to put into place. And about getting viral, I had heard about it, but really did not know what it meant. But then I think Dr. Sharan has mentioned he allowed his wife, Abhishek's wife, to come into the last part of the surgical part. And in the OT, she took a video, and then she put it up on the Facebook, and that went viral. And really, when we traveled to Antarctica, when we saw Santiago carried in Santiago Times his picture and news, that is when we actually understood what is viral.
I just want to mention one thing in the end, that if you have a dream, if you want to achieve something, then please don't quit. Keep on trying. Things will work out one day. There may be difficulties, there may be failures, but definitely one day everything will work out and everything will start making sense. If I can overcome my physical disability, then anything is possible.
Hi, I'm Sanjeev Gulati, and this is my wife Neena Gulati. We came to Bhagwan Mahavir Jain Hospital in on 5th of Feb of this year, and my wife had an unfortunate stroke. She suffered from a stroke last year, and this was in Chicago on June 19th. And she got the emergency help. She got good help in the hospitals in the US, and then the nightmare began from there.
Probably they weren't treated as adequately as they should have been treated, or they weren't treated as appropriately as they should have been treated. So they were getting frustrated, and they were trying to find out, and with the word of mouth and through Google and the internet and things, that are there any other places that they can go to. I know this particular person from the US, okay, and in the US they had given up this patient.
When they got here, we were surprised first because she is coming from the Western world where technology and the rehab facilities, as it is known, is at the peak. That means they are way ahead of what at present our neuro rehab services are. When they landed here and we saw her, as of what I explained, how her presentation was, we were also thinking, what can we deliver for her?
She was literally like a baby. She cries. She doesn't know how to communicate. If you give a brush, she doesn't know what to do with the brush. So she cries and things. And also she was very, kind of behavioral issues, like she showed tantrums like a child. During this time, we had to train her all her functional ability, including the toileting. Like, how do you train a baby? Like, if you have to pass urine, you have to say "Sss," and you have to show the toilet. So in the cognitively, you have to stimulate for her to pass at the right time. You have to show her pictures. Everything has to be stimulated. Everything has to be trained for her. Like even food, plate, spoon. So everything has to be taught to her.
I think she's come a long way now. So now she's at least able to hold a walker and walk a little bit, and she can do some things independently in the room by herself, and she's able to talk a lot. It's very sensible talking, right, Neena? Yeah. Can you tell your husband's name?
Sanjeev.
Yeah, and your kids?
And Vishal Roshi.
Vishal and Roshi.
And Theo.
And Theo is her dog. So she loves her dog a lot.
Oh yeah.
Right? Okay, so this has been her journey in the resort.
I could not even have dreamt, like in 8 months, we could actually hope to have this level of recovery. This is an absolute miracle, and this, obviously, I can, you'll appreciate me saying that, being her spouse, but even the doctors in my family did not, medically speaking, expect this recovery. Our battle does not end here. It has, I tell my friends, we have crossed the longest and the darkest tunnel in this journey, right? There are going to be more small tunnels on our way, and we are going to jointly navigate.
She had zero memory when she came. Yeah. Even of her own life. Forget about it.
Like this.
Now. I was like this.
How do you know that? How do you know that? Then put IV line there.
IV line
She's showing all of that.
Oh my God, I love.
Correct.
4 o'clock in the morning, you have to.
4 o'clock in the morning. Huh?
Yeah.
Oh, they're giving injection at
Oh, okay.
Oh, that I've never understood, Neena. What this hospital give at 4 o'clock in the morning? What scheme they have? I don't understand.
Early in the morning.
Yeah, anything. It's saying, let me sleep. I said, nothing. I'm like, oh my God. Oh, go to sleep. The water.
You're looking for the video,
Yeah,
huh?
I'm trying to see this thing.
Initial video, yeah.
Initial.
Oh, I
So
haven't
you know how
I've
bad
saved
it
but,
was. You want to see?
Yeah, of course.
See, this is July 4th.
Oh.
in the ICU. See this, not in the ICU, this is a private room. See how she is. This is July 7th, 2019. June.
Last year in 2021, July 15th, July 15th or 17th, just the problem arose for me is I could not lift the right leg on while sitting on a vehicle.
So Triveni is a case of ligamentum flavum hypertrophy. So when she came in before the injury also, she had weakness in her bilateral lower limbs. Around 2-3 months she had weakness. That's what the history behind this. So day by day it started deteriorating, and one fine day she fell in the bathroom.
Spasticity for a lay person is trying to drive the car with the handbrakes on. That means internally there's some handbrake happening, and it's resisting your movement that is happening. And spasticity is one of the commonest ways the nervous system recovers after injury. Okay, so there are two kinds of spasticity. You have helpful spasticity and harmful spasticity. Sometimes when there's a weakness in the limb, the spasticity is important to maintain the position of the limb. But if it crosses a certain line, then it becomes harmful and comes in the way of day-to-day operations. So the joints start wearing out faster, they get pain, swelling and everything else. So now how do you release spasticity? Releasing the handbrake and releasing spasticity is the same. So you have focal spasticity, which is small groups of muscles. Spasticity is basically over tight muscles that we have. So, or it can be generalized depending on that. Depending on the extent of spasticity, the treatments vary. A lot of medicines available, but many times those medicines don't work, or they're not enough, or they cause drowsiness and things like that. Then we start looking at other options. In the other options of treatment of spasticity, one is called the botulinum toxin, or Botox that we call, that we can inject into the groups of muscles that are tight to release the muscle. It's called chemodenervation procedure. It's a reversible procedure because it only lasts for 3 to 6 months, after which the spasticity can't come back. Other one is for a generalized spasticity, is called intrathecal baclofen pumps, or ITB. I've implanted an intrathecal baclofen pump for her in the anterior abdominal wall with a tube that is going into her back, and this pump has a tank capacity of 40 ml, and inside which the drug is placed, and that drug at a pre-programmed rate is delivering the drug through this spinal cord tube into a particular space on the spinal point on the spinal cord, which I have determined and kept the tip there. All right. Now this can be programmed, adjusted to as per the patient's requirements and needs. Normally we give a standard continuous dose for 24 hours. This is at micrograms per hour. Normally the drug is given milligrams in the orally, but somehow doesn't work because 90% of the times the drug doesn't cross the blood-brain barrier, which is like a checkpost in the brain. So now what we have done is, in her case, she is fine the whole day. From 9 o'clock in the night till 5 o'clock in the morning, she has some problems specific to that time, which involves tightness of the leg, lot of pain in the leg, and difficulty in turning in bed. So this programmer is designed, and the pump is designed in such a way that I can give additional doses at that particular point of time as per the patient's need.
So after ITP pump, muscle power improved, pain became completely, it stopped. Night are peaceful for her now. She's able to sleep properly. She's able to roll on herself independently, and then she's able to come up to sit to stand also. She's doing it independently, and then now she's walking without without any help. Only she's only holding the walker, and under supervision she's able to walk.
Everything I'm able to do myself. Uh, I should thank Sir Sharan Srinivas. Srinivas, I always pray Lord Balaji only. It's my favorite God, I can tell. I see doctor as God only. I can't express my feeling. How this 10 months, it was each day, it was terrible for me. Now I am thinking, after some days I can walk, I can go to my job, everything. I should thank my therapists. From day one to till now, Divya was in my journey only, and the other therapist also helped me more. Standing, I can tell Dikshita, Sona, all how they taught me standing. I can't forget. They are all a part of people in my family. Now I should think, because without them I could not achieve this success also.
I was working initially in Kotak Mahindra Bank as a senior manager. While I was traveling to the office, I met with an accident. It was a road traffic accident. So there were injury on my spinal cord. We had rushed to the local hospital. Then they shifted to the Spurs hospital for the further MRI and CT. So I got an injury. It was confirmed. So then it was like surgery after 4-5 days of my accident.
ಮತ್ತು ಆಪ್ರೇಷನ್ ಎಲ್ಲ ಆಯಿತು. ಆಮೇಲೆ ಅವ್ರು ದೊಂಬಳೂರಿಗೆ ಬರ್ಕೊಟ್ರು. ದಿಲೀಪ್ ಸರ್ ಅಂತ ಇದ್ದಾರೆ, ಅವರು ಸರ್ಜರಿ ಮಾಡಿದ್ದು. ಅವ್ರು ಅಲ್ಲಿಗೆ ಬರ್ಕೊಟ್ರು. ನಮ್ಮ ಫ್ರೆಂಡ್ ಅವ್ರ ಕಸಿನ್ ಅವ್ರು ಅಲ್ಲಿಗೆ ಬರ್ಕೊಟ್ರು. ಆಮೇಲೆ ಅಲ್ಲಿಗೆ ಹೋದ್ವಿ. ಅಲ್ಲಿ ಟೈಮ್ ವೇಸ್ಟ್ ಆಗೋಯ್ತು. ಆಮೇಲೆ ನಮ್ಮ ಭಾವನ ಮಗ ಒಬ್ಬರು ಶರಣ್ ಸರ್ ಈ ಥರ ಇದ್ದಾರೆ, ಅವರು ನಮ್ಮ ಭಾವನ ಫ್ರೆಂಡ್ ಒಬ್ರು ಇಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಿದ್ರು. ಅವ್ರು ಹಂಗಂತ ಹೇಳಿದ್ರು.
So this patient Kodandram, he had a road traffic accident, two-wheeler, and he had injured his back, and he was taken to another hospital where a friend of mine treated him. And he had, because of the injured back, he had paralyzed from waist down, both legs and things like that, and he was not able to move ever since the accident. So then he went to that hospital. They did an MRI and CT scan, and they found that a bone was broken in the back, and that was compressing his spinal cord, because of which he had got damage to the spinal cord. So what they did was they went in and operated him. They put screws in the back, they decompressed his spinal cord and made sure that it was all aligned and stable. So, and then he was in a post-op period, and within about 10-15 days of post-op period, he was shifted here for neuro rehab. Fundamentally, he came in for neuro rehab. And when he came in itself, he was having some pain in the leg, a little bit of tightness, which normally comes in much later, but for, in the patient's second month, third month. And they had already started some tablets, which is the normal thing that we do, and we were hoping that he settles down with that. But that thing just started increasing, and he would have severe pain in the leg, and especially at night, his leg would get stuck like this, go inside and get stuck, and he would howl in pain, and you would not allow anybody to touch him, and you can't pull out his leg, and it was like somebody just fixed his leg like that. And we were thinking, how is it happening so quickly, whatever it is. And then there's this tablet called Liofen or Baclofen, and that's one of the best drugs to give for this. And for a small set of patients, they don't agree with this drug. And the moment I increase it to 20 milligrams, he would be sleepy all the time. And there's a small subset of patients who have this drowsiness all the time, so we couldn't increase it any further. So when we have this problem, then we have an alternate to this, wherein we put a tube into the spinal cord directly and deposit the injection of this drug directly into the spinal cord, bypassing this barrier. That's what we do. So I suggested this to him. So, and this is done usually by a procedure called intrathecal baclofen pump implantation. We actually implant a pump in the abdominal wall, and the tube goes into the back. This pump is very expensive. So before we implant this pump, we have to justify to ourselves and the patient that it's worth doing it. So we do something called an ITB trial. We do a trial of this where we mimic the actual procedure, but the pump is outside. So I suggested this to the family, and because he was desperate, he said, let's try it. And we did that, put a tube into the spinal cord, and the tube was connected outside to the same syringe infusion pump. And you won't believe it, in just with 50 micrograms of the drug, not milligrams, micrograms, he was pain-free, spasms went away, and he was very happy. By the time we had implanted the pump, this whole process took a couple of weeks of, from the time he came in. He had started moving, developed some movement in his, both his feet a little bit, left more than right, a little bit of movement around the knee joint. And the moment I gave him this 50 micrograms of the drug, when I implanted the pump, this movement went away. Now, it's very unusual. Normally, when we implant the pump, the first thing, the starting dose is usually 100 micrograms. Because he was very sensitive, I had given him only 50 micrograms. So 50 also turned out to be too much for him. It's like a pediatric dose. So then I told him I'll make it 25 micrograms. That's the least dose that the pump allows in an adult. So I put 25 micrograms, and then he was okay. It's been, 2018, I implanted the pump for him, And from then on, the pump, the dose has hardly increased. From 25 we came to slowly to 40, 45. Now he's at about 53. That's it. It is the lowest among all the pump people that I have put. And with that, he's really reached a stage where the spasms are gone, and and he's able to now walk with elbow clutches. So I think it's a great tool to have. It's called interthinking. So one of the process of neuromodulation surgeries that I do, and it's a great thing. And though I put it for spasticity, this also helps relieve the pain. So one day he actually asked me, am I pump dependent? And then I said, we only know if you are not out of the drug. And during the pandemic time, once the drug had gone off, there was a little bit of struggle in identifying the drug because everything was locked down and things like that. And he got the spasm back. So he knows that it is still there, and the drug is helping him. But it's made a big difference.
The days which I passed, it was in nowhere to somewhere, I can say, because from a zero power to walking independent and in walker, it's a too hard journey to travel, because the efforts which have been put, if I put in 50% efforts, the efforts has to be from the doctor and the therapists. Okay, I cannot say it's from me only the 100%, because there were so many complications would be there, so many things would be there to look after that. They would be checking on the small changes in the body, or small changes in the motor nerve or sensory nerve, how you could add value to the thing. 2 or 3 of the therapists, initially the Priyanka ma'am was there. She was a senior therapist here. She was the one who took care of me initially. It was a very hard job to get my muscle powers or something which magical happened with her, along with continued with Deva Prasanna and Kaleshwari. These were the 3 where I am today, and for all of these 3 people, Sharan sir and Pratibha ma'am are the backbones.
मुश्किलें तो थी बहुत, कदम तूने बढ़ाया, जिंदगी की चाह ने चलना तुझको सिखाया। आंखें गड़ी हो मंजिल पे तो धूप छाँव सी लगती है, पथरीली राहें हो फिर भी सफर सुहाना लगता है। चल चला चल चला चल तू, चल चला चल चला चल तू, हम भी तेरे साथ हैं। लगता तो ये जादू जैसा तुझ में भी और मुझ में भी, सपनों को बुनने से डरने में क्या चल चला चल चला चल तू, हम भी तेरे साथ हैं, लगता तो ये जादू जैसा तुझ में भी और मुझ में भी। करता रहे तू कोशिशें लगातार, ख्वाब तो ऊंचे है तेरे यार, इम्तिहान से अब है कैसा डर, चल उठा के तू अपना सर, बदलना था तकदीर को, बदला है इतिहास तू, सूरज की किरणों से आगे तो देख अब निकलेगा तू। चल चला चल चला चल तू, चल चला चल चला चल तू, हम भी तेरे साथ हैं, लगता तो ये जादू जैसा तुझ में भी और मुझ में भी, तुझ में भी और मुझ में भी, तुझ में भी और मुझ में भी, तुझ में भी और मुझ में भी।
Most of the patients have been satisfied, most of the patients have recovered. I won't say 100% because we are also human beings. I mean, we are not God. Okay. But the majority of patients have gone back entirely satisfied, and there's been a lot of testimonials that have been coming from patients. There's been a lot of feedbacks coming from patients.
देन हाथ के स्टिफनेस बहुत ज़्यादा थे तो यहाँ पे बोटॉक्स लगाया तो उससे ये लूज़ हो गया हाथ भी, एंड अभी वो है आयुर्वेदा भी करा रहे हैं, ओटी भी करा रहे हैं, थेरेपी, सो काफ़ी इम्प्रूवमेंट है और लग रहा है कि सही हो जाएगा बिल्कुल. वी आर ऑल्सो पॉजिटिव एंड दे आर ऑल्सो वेरी पॉजिटिव एंड दे आर वेरी सपोर्टिव.
The way the therapists have handled her, the way they've taken care, the doctors, accessibility to doctors here, to whether it's Dr. Sharan or Dr. Pratibha or any of the supporting doctors who come in, I think it's been phenomenal. Right? And to summarize, I probably say that I'm very happy that I brought her here.
ಶಿವಣ್ಣ ಅವರು ಮುಂಚೆ ಒಬ್ಬರೇ ಎಲ್ಲೂ ಓಡಾಡೋಕೆ ಆಗ್ತಾ ಇರಲಿಲ್ಲ ಅಂತ ಹೇಳಿ ಅವ್ರನ್ನ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ ಎಲ್ಲ ಇಟ್ಕೊಂಡು ಕರ್ಕೊಂಬಂದಿದ್ರು ಫಸ್ಟ್ ಟೈಮ್ಗೆ. ಆ ಫಸ್ಟ್ ಟೈಮ್ಗೆ ಎಲ್ಲ ಫ್ಯಾಮಿಲಿಯವರೆಲ್ಲ ಕರ್ಕೊಂಬಂದು ಜೊತೆಯಲ್ಲಿ ಸರ್ಜರಿಗೆಲ್ಲ ಮಾಡಿಸೋದಕ್ಕೆ ಕರ್ಕೊಂಬಂದು ಅವ್ರ ಜೊತೆಲೇ ಇರ್ತಾಯಿದ್ರು. ಅದಾದ ನಂತರ ಸರ್ಜರಿ ಆದ ನಂತರ ಎಷ್ಟು ಇಂಡಿಪೆಂಡೆಂಟ್ ಆದರು ಅಂದರೆ ಒಬ್ಬೊಬ್ಬರೇ ಬರ್ತಾಯಿದ್ರು ಫಾಲೋ ಅಪ್ಪಿಗೆ ಒ ಪಿ ಡಿಲಿ. ಅದನ್ನೆಲ್ಲ ನೋಡಿದರೆ ಸಂತೋಷ ಆಗುತ್ತೆ, ಯಾಕೆಂದರೆ ಒಬ್ಬರೇ ಬಸ್ ಹತ್ಕೊಂಡು ಒಬ್ಬರೇ ಇಲ್ಲಿವರೆಗೆ ಬಂದು ಫಾಲೋ ಅಪ್ಪಲ್ಲಿ ಸರ್ಗೆ ತೋರಿಸ್ಕೊಂಡು ಹೋಗ್ತಾಯಿದ್ರು ಸಂತೋಷವಾಗಿ.
I never thought that such a drastic improvement will come for this problem. Ganapati sir, then Divya madam, Dikshita, Neha and Sneha. This five people who have put enormous effort, and all these people's efforts have made me 80% cure.
क्या करने से तकलीफ होता है?
चलने या खड़े होने से बहुत सारा खिंचाव होता है.
మీరు కై ఆరామ అల్లాడలేదు.
We are very clear we will not guarantee 100% success because it's not possible. I don't think even God is possible to say 100% success. One thing I tell everybody who comes in here, you will get 200% effort from us, number one. Number two, we are the only people with a patented process in India for sure that we are able to map the whole process. So we can guarantee if you engage with us long enough, we can get the best possible result.
Sharan sir said that we believe in God and we will both work. We don't know how much far we can go, but we will keep on working, he said. And we started to work, and I think this will be a magical recovery. When I look after the other patients as a spinal cord injury, in a total of 100 patients, only 4 to 5 patients will recover to this level, as of I know. Because I have seen the patients where they struggle little more, if it's a stroke also, if it's in other patients also. This speedy recovery, maybe they would be saying that of 7 to 10 years they would take to reach this level as where I am now.
So for standing and walking, minimum we need muscle power 3 for a normal individual also. So for him, for Kodanda sir, it is 0 when after the accident. That is, and muscle tone is since now we are free, now our leg is free because we have normal tone, but his leg is like it is increased tone, it will be like this, and after sometimes he will relax. When he is doing movement also, he has to struggle like tightness. So that is spasticity. So after spinal cord injury, incomplete injury, this spasticity, most of the people will have the spasticity. So we have to control that, then only this muscle power he will get. So we are working towards to achieve the muscle power 3, but still he didn't achieve the 3. That's the struggle because muscle tone will increase. Clonus in the sense it is shaking. When he stand, it will shake like this. So this is a barriers for him. So that is the reason sir put a baclofen pump for him. First, when he was coming, he has this muscle strength, everything is 0. Functional also 0. In the sense, someone has to lift him and make him sit. Even he can't turn and lie down. So we use the scale spinal cord injury functional assessment scale we will use. In that, at present he is in 70 score. Out of 100 he is in 70 score. But when he was coming, it is like 0 to 10 only.
So my name is Anand. I joined as a CNO and Chief Nursing Officer for the neurosciences and rehab. Especially for the 2 types of feeding will be there. One rise tube feeding will be there and peg injections will be there. Positioning change. Second hour we have to change the position, avoid the bed sore.
But even the doctors in my family did not, medically speaking, expect this recovery. Now, what could be the reason? Is it the fact that she's 52 years old, young? Yeah, that is partially the reason. Yes, but the more important reason is the rehab team led by Dr. Pratibha Sharan, working in tandem with Anita. Right, the 2 of them came together, and amazingly, 5.5 hours every day of rigorous rehab, day in and day out, 6 days of the week, and the result is this in 8 months, which is phenomenal, right? I cannot be more, I cannot ever thank you enough for what you have done for Nina, and you've given her a new life.
ಎಲ್ಲ ಫ್ರೆಂಡ್ಲಿ ಆಗಿದ್ದಾರೆ ಸರ್. ನಾನು ಇಷ್ಟು ಆರಾಮಾಗಿ ಮೂವ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಅಂದರೆ ಅವರೆಲ್ಲ ಹೆಲ್ಪ್ ಮಾಡಿರೋದ್ರಿಂದನೇ.
I couldn't sleep even for 5 minutes before. After they pump out of the put the pump, I can sleep peacefully now.
Cognitive training, really, the 6 months, almost for 6 months to 1 year, the training has helped me to clear multiple job interviews. Probably a couple of them would be something similar to Citibank. I was heading the country portfolio of one of the commercial cards in India, Citibank in India. So as a vice president, I used to manage a lot of corporate clients and business management of that. And then continuing with the launch of a business in one of the matrimony site, yes, it is important that the decisions has to be made. And the training has really helped at that point in time to recoup myself to the similar activity. And then after I cleared the job interviews, the latest one I took up was managing a travel business for multiple countries in Middle East. And of course, I used to travel to those countries as well to meet the channel partners and the airline heads over there to make decisions on the plans, how we should move forward. Over a period of probably a year, slowly and steadily, I realized that okay, what went through within my family after my accident was I never got bothered about it till then. And when I realized, then I felt like I should move back with the family, stay with them, than being away and supporting them emotionally and probably financially. Hence, kind of decided to move on and took a job role in railways to be in Trivandrum and staying with them for the last couple of years, happily and peacefully well.
When I took selfie with you, it is good now, Vidhi?
This selfie लेना selfie. एकदम जोरदार डबल पिन किया.
It is from Bombay.
वाह, श्री शरण
विधि देखो विधि.
कुछ भी थोड़ा हाँ वो साइड पर राइट में.
पैक का हो गया, पैक करने से. 3, 2, 1. आगे 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 आगे. Very nice. चलो आराम से पीछे.
आगे जल्दी.
Come on.
1, 2.
मैं घर आऊँ विधि के. हाँ. तो विधि कॉल करेगी ना जाने के बाद में.
ऐसा धीरे. Water. Right, left, straight Vidhi, straight Vidhi.
जाना होगा।
प्लीज थोड़ी देर और रुक जाओ ना।
तुम समझती क्यों नहीं, अगर मैं यहाँ रुका तो
क्या?
तो वहाँ भंडारा खत्म हो जाएगा।
घर में मैं खाली हो जाऊंगी।
दिन भर मेरा खून पीती है, लाल तो नहीं हुई तू?
यार तुम कितनी स्वीट हो, ऐसा तुम लोग मुझे बोलो, ठीक है?
Being doctors, there are enough number of times we see patients who cannot afford the surgeries and things like that. There are enough times that, they are like two-wheeler, they were riding, some small town people or an auto rickshaw driver or a cab driver, they have an accident. How much money would they have saved and kept? Right? So in the acute care, lot of money gets spent off. Sometimes they don't even have money for the acute care itself, whether it is a neurosurgical problem or a spinal problem, whatever it is, there is going to be a X amount of money. Then the ICU, then the ward, the hospital stay itself is very expensive. When it is life-saving, people would run pillar to post, organize, take a loan here, take a loan there, hand loans, borrow here, there, sell off the jewelry, sell off the houses, sell off the Mangal Sutra. They do everything possible to save the person's life, right? Because it is acute and the heat is on. That's in the beginning. They would have finished everything. Then comes the rehab, which is again a long-term process. Rehab is not like 5-day, 10-day or a prescription-based thing. It goes for months to years sometimes. It can, right? So if the funds are over at that time, the so-called well-to-do people are also out of funds by the time they come to rehab, okay? And then the whole journey starts.
So we have designed some cost-effective packages, despite we being actually not very high on cost, we are moderate otherwise also. So despite that, we also have designed some packages wherein the patient can afford. 90% of them are not having excessive funds in their hands, so they do ask for certain concessions. So we felt this is kind of repetitive.
So we found that a lot of people were rehabable but were not able to afford, even if you find discounts and do some free therapies. So that is when we decided we will have this wing, the NGO. It is called Swasthya Arogya Foundation. It's all need based. When we have a patient who can't afford it and we know rehab can help them or this particular surgery can help, we put in a message to all our known people, close friends, family, all this. So we get a lot of people funding, 1,000 rupees to 5,000 rupees to 10,000 rupees to 25,000 people have given, and for that case we tide over. So that is how we've been surviving with this. It has been very supportive for us too. Some of the patients we've got very good results thanks to the people who have supported these people, funding them at the right time.
ಫ್ರೆಂಡ್ ಒಬ್ಬರು ಹೇಳಿದ್ರು ಇಲ್ಲಿ ಬನ್ನಿ ಅಂತ. ಸೊ ಇಲ್ಲಿ ಬಂದಾಗ ಬಟ್ ಇಲ್ಲಿ ಅವಾಗ ಅಫೋರ್ಡ್ ಮಾಡೋಕ್ಕಾಗ್ತಾ ಇರಲಿಲ್ಲ. ಸೊ ಅವಾಗ ಫ್ರೀ ಥೆರಪಿ ಮಾಡಿಕೊಡ್ತಾಯಿದ್ರು ಮ್ಯಾಮು, ಶರಣ್ ಸರ್ ಗೊತ್ತಿರಲಿಲ್ಲ ನಾನು ಯಾರು ಅಂತ. ಆಗ ಮ್ಯಾಮ್ ಮಾತ್ರ ಕರೆದ್ಬಿಟ್ಟು ಕೊಟ್ಟಿದ್ದು. ಸೊ ಅವಾಗ ಫ್ರೀ ಥೆರಪಿ ಮಾಡ್ತಾಯಿದ್ದೆ. ಒಂದು 6 ಮಂತ್ಸಿಂದ ಬರ್ತಾಯಿದ್ದೆ ನಾನು ಆಗ. ಆಮೇಲೆ ಸ್ವಲ್ಪ ದಿನ ನಾನು ಎಕ್ಸಾಮ್ಸ್ ಇತ್ತು ಅಂದ್ಬಿಟ್ಟು ಬರ್ತಾ ಇರಲಿಲ್ಲ ಥೆರಪಿ ಮಾಡಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ.
He came back one day and gave me sweets. So I said, for what? He said, I actually finished my BCom. So then I asked him, okay, good. I mean, congratulations. Now what? What next? He said, ma'am, I want to join job somewhere because I want to earn my living. I said, fair enough. Have you applied somewhere? What is the plan? So he said, ma'am, applied, but then, with my condition, he is wheelchair bound. So he says, I don't know where I will get. I'm not really sure how I can go. So I asked him, do you mind working here? And he was very happy to do that. And since he was a BCom graduate, language was good and smartness was there, brain was working. So there was no deficit there. So he was interested. So he said, any work you give me, ma'am, I can do. So I just did a little bit of a skill test on him, and he said he would like to do the front desk job. So I have hired him as a front desk executive. We are not going to stop because there are enough good people who will fund. So we will run this parallelly so that we can help lot more people. Otherwise they can't come in, because if they can't afford, they sit at home. And it is more important when they can't afford, they need to get back to community and they need to start working and earn some money at least for them. Earn for themselves, if not a family and everybody else. At least if they can look after themselves and earn a little money, that is. So they need rehab more than the affordable people.